Okay, we're going to touch on some areas in Chapter 16. So if you pay attention to your objectives for this chapter, you'll see it's really not specific towards the medication so much as to being able to identify some of the disorders and developing teaching plans and applying the nursing process and so forth, and being able to differentiate between different types of disorders in adults. We are seeing more and more patients with PTSD. So with PTSD, as a child, post-traumatic stress disorder is the same as and characterized as it is in adults by this persistent experience, some type of traumatic event that they play over and over, and the individual, becomes very fearful. They feel helpless and horrified by what they've experienced. Some examples could be those who have been in military combat, maybe someone being a prisoner of war, natural disasters, human disasters, crimes, especially very violent crimes, and also some type of life-threatening illness may also cause that. The symptoms usually can begin about a month after the exposure, but sometimes it can be delayed by months or years in some individuals, so that may not, but that's usually not an uncommon thing to see as well. When they're re-experiencing, they're having what we call the flashbacks, and sometimes there's avoidance, and that's avoiding any type of stimuli associated with the trauma. So someone who may have been in combat doesn't like to go to the fair where they shoot off fireworks. As I said, with PTSD, it can have a long lag, and screening should always be ongoing for someone who has been in this type of situation. Persistent symptoms can be that they're irritable, they have insomnia, lack of concentration, maybe exaggerated startle response, and these can come out of the blue. And again, they can also have an alteration in their mood, such as chronic depression. With adjustment disorder, as you can see here from these bullets, the nurse needs to build trust and show compassion in the face of a lot of these adjustment disorders. Therapeutic responses are going to provide these patients with comfort, and the nurse should show patience and tact while offering a lot of warmth and sympathy to the patients. The epidemiology and comorbidity for this is that more than twice the number of women are affected than men who develop PTSD. And some of the comorbidities include, again, anxiety, depression, sleep disorder, and dissociative disorders. They have difficulty with social and interpersonal and maybe even occupational relationships, while trust seems to always be the common denominator. I mentioned dissociative disorders on the previous slide, and so when we talk about these are disorders that occur after some type of adverse event or experience that's very stressful, and so they will actually develop some type of unconscious defense mechanism to protect themselves. So then when we think that when they have this separation of emotional and these anxiety that affect them, they'll actually just have a disturbance in their memory, consciousness, self-identity, and their own perception. They have an intact reality testing, so that what that means is that they may have flashbacks or images, and they're triggered by current events, but they relate them to the past trauma. And so disassociation is involuntary, and it results in a failure of normal control over their mental processes and how to integrate conscious awareness. And these dissociative disorders are on the next slide. They're depersonalization and derealization disorder, dissociative amnesia, and then a dissociative identity disorder, also known as DID. If you ever saw the movie Sybil. And then there's also, that was in 1976 with Sally Field. It's an excellent movie. It's very intriguing. Another one that's more, I guess maybe up to date for y'all is Me, Myself, and Irene, made in 2000, which is another one about different personality disorders, DID. Very interesting. Nearly all patients with DID have some type of history of child abuse or trauma, and that is what's called it. And with Sybil, we found out that she had a very traumatic and abusive child life, which brought on all these different personalities. One of the things that you want to do is clarify their history and course of past symptoms or events in their life. You want to get a clear picture of any current physical, mental, and their safety status. You also, many times, they're misdiagnosed with just depression, schizophrenia, or borderline personality disorder. As far as their moods, they're very anxious, depressed, or unconcerned. So they have mood shifts. When the alternate identity takes control, the mood will change. During the fugue states, patients' new identities function adequately by choosing simple, undemanding jobs, have a few intimate social interactions. DID patients have family and work problems, is what we see during these fugue states. For depersonalization, patients fear others will see them as distorted, and they try to avoid being seen in public. And that can have a huge impact on the family. They may have thoughts of suicide, so we do have to make sure we keep their safety up front, and number one. So on the self-assessment, nurses may be skeptical, maybe even uneasy to interact with these individuals. And they can even get caught up in the intrigue of these patients. Trust occurs very slowly, and medical records can be used as a court exhibit if needs be. Look at tables 16.1 and 16.2. 16.1 is on page 319, and 16.2 is on page 320. Psychoeducation, you want to normalize experiences by explaining that their symptoms are really adaptive responses to past events that were overwhelming. Grounding techniques are taught to make them more aware of noticing things that are real in the present, to counteract episodes. Pharmacologically, there's no specific meds. Now, we can give antidepressants, anti-xylotics, antipsychotics can be prescribed for those hyperarousal or any kind of intrusive symptoms that they may have. During the crisis intervention, it's important for us to stabilize our patients. And again, psychotherapy can be used to help to improve their situation to a state that is more level and functionable.